Toxicology begins with understanding the types of samples that can be used for testing. Urine is the best specimen for screening purposes. It is used qualitatively, meaning the results are simply positive or negative. Blood samples, whether whole blood, serum, or plasma, are used quantitatively to measure levels for clinical correlation with impairment or toxicity. Oral fluid, sweat, and hair can also be used for qualitative testing, though they have different cutoff levels, especially in workplace testing. Finally, other specimens such as tissues, nails, or bones are typically used in post-mortem analysis or for specific poison detection. The methods of toxicology testing can be divided into immunoassays and chromatographic techniques. Immunoassays are most often used for initial screening. They can detect drug classes, specific drugs, or their metabolites. However, workplace drug testing requires presumptive positives to be confirmed by more specific methods. Chromatographic techniques are highly valuable for both detection and quantitation. Gas chromatography and high-performance liquid chromatography separate substances, while detection is usually performed with mass spectrometry. Gas chromatography mass spectrometry and liquid chromatography tandem mass spectrometry are considered the gold standards. Thin-layer chromatography, while simpler, is less sensitive and less specific. When it comes to drugs of abuse, testing is performed both in workplace settings and in clinical emergencies. Workplace testing is regulated by federal programs such as NIDA and SAMHSA. These programs set standards requiring controlled collection tamper-proof seals and chain of custody procedures. Certified laboratories must meet strict requirements including inspections, proficiency testing, security, and trained personnel. Confirmation of drug use involves immunoassay screening followed by gas chromatography mass spectrometry or liquid chromatography tandem mass spectrometry testing. Specimen validity testing is also included, which checks creatinine levels, pH, and oxidizing activity to determine whether a sample is dilute, substituted, or adulterated. Typical drug testing panels vary depending on the setting. For workplace testing, urine is the common specimen and is screened by immunoassay. The panels often include benzodiazepines, barbiturates, and tricyclic antidepressants in addition to standard workplace drugs. Blood, plasma, or serum may be used to test for ethanol, often using alcohol dehydrogenase enzyme assays on automated analyzers, or a breathalyzer in field testing. Urine biomarkers such as ethyl glucuronide and ethyl sulfate can indicate alcohol use, though they are not typically used in overdose testing. Finally, plasma or serum testing may be performed for salicylates or acetaminophen, especially if the patient's history or circumstances suggest potential overdose. Let's further review the drugs tested in workplace and some clinical panels. In workplace and clinical drug testing, a variety of substances are screened to detect potential abuse or misuse. These panels include amphetamines, cannabinoids, cocaine metabolites, opiates, PCP, MDMA, and other opioids. Amphetamines include compounds such as amphetamine and methamphetamine. A well-known example is Adderall, which is a prescription amphetamine. However, the standard assay does not detect MDMA or MDA. Cannabinoids are represented by THCA, which is the primary metabolite of marijuana. For cocaine, the main metabolite that is detected is benzoylecgonine, which is the primary breakdown product of cocaine. Opiates include codeine and morphine. It is important to note that morphine can also be a metabolite of heroin. Phencyclidine, or PCP, is commonly known as angel dust. It is classified as a hallucinogen. MDMA, also called ecstasy or Molly, and MDA, also called Sally, are both members of the amphetamine drug class. However, they are not detected by standard amphetamines assays. 6-acetylmorphine is a specific metabolite of heroin. It has a shorter half-life compared to morphine. A positive test strongly indicates heroin use, but a negative test does not rule it out completely. Other opioids include oxycodone, oxymorphone, hydrocodone, and hydromorphone. These opioids are not detected by general opiates assays, so special testing is required. Acute poisoning can result from a wide variety of substances. Each has distinct mechanisms of toxicity, clinical presentations, and treatments. Acetaminophen poisoning is one of the most common causes of drug-induced liver injury. The danger comes from the accumulation of a toxic metabolite, which causes liver damage within 48 hours after ingestion. Fortunately, the antidote, called N-acetylcysteine, also known as mucomist, can be very effective if given within the first 24 hours. Certain alcohols can be toxic, including ethanol, isopropanol, and ethylene glycol, which is commonly found in antifreeze. Another extremely dangerous toxin is cyanide, which interferes with cellular respiration and can be rapidly fatal if untreated. Carbon monoxide is a silent killer. It binds to hemoglobin with an affinity about 200 times stronger than oxygen. This prevents oxygen from being delivered to tissues, leading to hypoxia. It remains one of the leading causes of poisoning-related deaths. Exposure to heavy metals, such as arsenic, mercury, and lead, can cause serious toxic effects. Lead, for example, interferes with enzymes that are necessary for hemosynthesis, which in turn disrupts blood cell production. Chronic exposure to these metals leads to widespread organ damage. Organophosphates, which are commonly used in pesticides, act by inhibiting cholinesterase enzymes. This includes both red blood cell cholinesterase and plasma pseudocholinesterase. The result is overstimulation of the nervous system, producing a range of central nervous system symptoms. Finally, salicylates, such as aspirin, can cause a dangerous overdose. The poisoning produces mixed acid-base disturbances, including metabolic acidosis and respiratory alkalosis.